it means, but spending a lot more time in figuring out the when we might be thinking about helping someone apply for Social Security. And so I will start by saying I am not an expert in Social Security, so I don't want people to think that anything that I'm saying is the gospel according to Social Security. I'll be giving you resources that you can kind of check the official pieces. However, I've been in community psychiatry all of my career, and so really needing to make sure people understand these are aspects and pieces of our patients' lives that's really important for us to understand. And so I'm going to start with just this brief overview of the different benefits that most of our people would be utilizing if they're on Social Security, and we can kind of move on from there. First, understanding the definition of disability according to Social Security. So some of you may at some point in your career already have or will be helping someone with the paperwork or get the forms to determine if someone is considered disabled. So just having an understanding, Social Security defines disability as having a medically determinable physical or mental impairment that is either expected to result in death or has lasted or is expected to last for a continuous period of at least 12 months. As a result of that impairment, they are not able to engage in what they call substantial gainful activity. You'll hear people use the initials SGA. And if you've been in medicine for any period of time, initials are everywhere. So every system has their own initials, but you will hear SGA tossed around a lot. So what is SGA? It's substantial gainful activity. Substantial, doing significant physical or mental activity. Gainful is based on earnings guidelines. So the 2022 SGA is $1,350 a month. And that SGA is not applicable for SSI, people who are under 18 years old. And we'll kind of talk about that a little bit. So when I hear people talking about youth and young adults, the SGA does not apply there. The one caveat I want to make sure people understand, if someone becomes disabled and has worked before, it's not that they can't continue to do the work they were doing. It's that they can't engage in substantial gainful activity. So if you have someone that was doing some high level position and now they can't do that anymore, Social Security is not going to necessarily see that as disabled if they can do other work that is considered substantial gainful. So that's just one piece to kind of keep in your back pocket. So take a piece of paper, open your favorite calculator app, something. I want you to do the math. How much do you currently pay either in rent or mortgage? How much do you spend on food in any given month? Groceries, takeout, delivery, your favorite beverage, things like that. How much do you spend on transportation, whether it's gas, insurance, maintenance of the vehicle, public transportation fees, Ubers, things like that. Utilities, electric, gas, internet, phone, clothing, entertainment, including streaming services, things like that. So I'll give you a second to add that all up. Now, show of hands. How many of you consider yourself living large? You are living the high life. This is like, everyone wants to live like me. So look at that dollar figure of how much things cost you right now, whether or not you consider yourself living large. Now let's take a look at what Social Security looks like for people. The one thing that you might have heard of is SSI. So that's Supplemental Security Income. SSI kicks in when someone doesn't have a significant work history. It's needs-based, so that's based on income and resources. This is part of the exercise. Right now for 2022, the full monthly benefit for SSI is $841 a month. And additional household income may reduce that benefit. So for example, if someone lives with their parents, their parental income will also come into play and may reduce that 841 downward. And there's a resource limit of $2,000 per person. So they allow for like a vehicle, and let's say they own their residence, they can own that primary residence, but checking accounts, savings accounts, other kinds of resources are capped at $2,000 for an individual. I put the asterisk down here for SSI to be aware when someone turns 18, there's different criteria that then qualify someone for SSI. So if someone was found eligible for SSI before they turned 18, then on their 18th birthday, they're under a completely different set of criteria. And so that's where that SGA kicks in and some other pieces. We've had situations where people on their 18th birthday, no warning, their check just stops. So this is just something to be aware of, so that if you are working with someone that's in that realm, to make sure that we're kind of checking in advance with Social Security, what kinds of documentation or what needs to happen so that that benefit would continue if the person is still considered eligible. The other program that most of our people might be, well, we might have heard of, is the Social Security Disability, or SSDI. There's a lot of initials in here. So SSDI is based on the insured status of an individual based on their work history. So depending how much work someone has had in the previous time leading up to becoming disabled and what their income was in those previous months determines how much their SSDI check will be. It's not needs-based. It's based on their earnings that were paid through Social Security. It's not impacted by the income of others in the household. There's no resource limit. So this is purely based on that work history and where things are. Two things to keep in mind. The one, some people, especially younger, may be receiving benefits under their parents' earnings. So you may have someone that you're working with who doesn't have a significant work history and yet is on SSDI. And that's likely because they were disabled young enough and they were put under their parents' earnings. The other thing that can happen is if someone's earnings, they may still be eligible for SSDI, but their monthly check is still less than that $841. So they may also receive SSI because the amount of the SSDI check falls below that cap. However, that then means that they have to follow the SSI requirements of it being needs-based, so they can't have the other resources, things like that. So it's a lot to kind of keep in mind. The other piece that sometimes people get confused about, and I don't have this on a slide, is the difference between Medicaid and Medicare. Medicaid is at the local level, and that's also a needs-based program. So that falls into those income and resource requirements. Typically, and Ohio is one of the states, someone who is found eligible for SSI is kind of automatically eligible for Medicaid at the local level. Medicare is the federal insurance, and that's linked to the SSDI. So again, it's not the needs-based, but it's based on whether someone is eligible for Social Security disability, and they have to be disabled for 2 years under the SSDI criteria before Medicare will kick in. So that is not the full breadth and depth, but that gives you kind of an overview of what SSI and SSDI includes and what people kind of face and struggle with. So put this in context of kind of what that would look like within a year. Someone who's receiving that maximum SSI $841 a month over the course of a year will bring in $10,092. A person who's working 30 hours a week at minimum wage is equivalent of $14,500 a month. The current federal poverty guidelines is at about $13,600 a month. And that SGA that we referenced earlier at $1,350 a month is $16,200. So we can kind of see contextually, people aren't living large on Social Security either, when we were kind of talking about our own standard of living right now. And it's important for us to think about that when we think about the decision process of helping someone decide whether or not to even apply for Social Security. So I tried to find what happens, what proportion of people that are awarded disability actually come off disability. There's not a lot of good data out there. And so really trying to look at this one study was showing that fewer than 3% of people who are awarded disability, SSI or SSDI, ever stop receiving the benefits. So if we think about what that standard of living looks like for an individual, when we think about what that means to an individual, that fewer than 3% are coming off. And then also the effect of long-term disability associated with poverty and social isolation, poor health outcomes, social stigma, pieces like that. We really need to think about what we're helping people do and how we can help people kind of progress in their goals. So I'm asking people to put in the chat box right now, if you know what % of people you're working with are currently on SSI or SSDI. If you're not 100% sure, just put your best guess. I don't know if I'm not seeing chat or people aren't putting stuff in the chat.
Maybe for the students, if you think about the residencies that you're going to be going to, maybe what kind of percentage of patients do you think will be seen who are on SSI or SSDI in those locations?
So I'm seeing about a third, 50 to 75, 65 to 70. So high proportions that we think, people are on SSI or SSDI. So one program that we support through the Best Center is for individuals who are experiencing that first episode of psychosis. So again, these are going to be youth and young adults, typically in that first episode. So found a couple studies that showed about the prevalence rate of people then receiving or getting onto benefits during the course of these specialty programs. So the RAISE study is the NIMH study that really looked at the intervention process for early intervention. Saw about 9% came into the program on Social Security, and during the course of 2 years, engagement went up to about 34%. A different program, about 2.5% were on Social Security coming in, and they estimated about 18% went on to obtain benefits. So lower than what some of our folks here are predicting in that 50 to 75% range. And one thing we would hope to see, especially when people are younger, that we're really trying to help them kind of navigate and find their best direction. So when we're thinking about Social Security disability, if someone isn't already on it, I want us to really think about the how, the when, or if we encourage people to apply. And so that program for early intervention actually doesn't encourage people to apply initially. That doesn't mean that we don't encourage it, that we don't support it, but we really want to help people kind of find what's going to be their best path. We do encourage them accessing that healthcare piece. And it's really this focus on helping people achieve those employment and educational goals so they can go on to function independently. And that's this concept of shared decision-making. How do we figure out what is the right choice for any individual at any given time? And it's really kind of thinking through the pros and cons and what that's going to look like.
I had a question, I guess,
Absolutely.
what you had just mentioned. So how many of the, like from a few slides ago, you said that about 3% of people who are then receiving these benefits continue like for the rest of their lifetime. Are there any stats saying that like of the people who are receiving the SSI or the SSDI benefits, like whether they go on to at least restart their employment at all or no?
Yes, so there's, and we'll talk briefly at the end, but that's an excellent question. So yeah, about 3% come off benefits entirely once they start. you're correct. There are people that will work at some level. And so if we think about the SSI, looking at what those income caps are and what can happen that people are underemployed because they still stay on those benefits. Part of it is, again, part of our decision process and how we work with people. Sometimes I'll even see employment programs that will help people figure out what's the most you can work without losing your benefits.
Okay.
And so while that's a strategy, I would encourage us all to think about what is the implication of only encouraging people to work within those guidelines as opposed to work to their maximum abilities. So when we're going to go through this exercise, but that's an excellent point is, once someone goes on, what then happens? And so knowing that only about 3% actually come off, that might also help us in this decision process of why people may or may not even apply in the first place, or what we can help so they can really achieve their goals.
Okay, thanks. And just to
Thank you.
clarify, I guess anyone who goes on SSI or SSDI, both of them are eligible for still continuing employment, correct?
Yes.
Okay.
Yeah, and there's a lot of incentives that have been built over the years to really try and help people retain as much of the Social Security support while they're getting themselves stabilized within employment situations. So there's a lot that can really help people transition back into, or for the first time, an employment situation. The challenge is really helping people access those supports and making sure that they really think about that these are options for them, as opposed to getting kind of stuck in that mindset of, once I'm on disability, that's the rest of my life.
Okay, thank you.
No, excellent question. I appreciate that. So what I'm going to have us do right now is really walk through kind of these decisional balance aspects of applying for Social Security. And so first, I'm going to ask people to put in the chat, what do you think the benefits or advantages are of applying for Social Security? Just go ahead and put it in the chat. No advantages. There's no advantage to applying for Social Security. So I see stable income, some cushion if you're not able to provide for yourself. Any other advantages to applying? Get some income and health insurance. So when I was preparing for this talk, what I came up with was that it is income, and it may also reduce the stress on their finances and allow them to really focus on that skill building. Give people time to get well, absolutely. So now let's think about what are the costs or the disadvantages of applying for Social Security. And again, let's put it in the chat, or we have a small enough group of people want to just say it out loud. What might be some disadvantages to applying?
The amount of stress, both on the individual and the families, in that the process of application is very, very long and very, very demeaning, and so that the quality of one's life during the waiting time is absolutely demoralizing.
That's an excellent point. I've heard people say it can take up to 3 years.
Yes.
In the application process before you even get the determination. And so kind of what's happening in that meantime. And I'm seeing in the chat the perceived stigma that someone might not want to. Excellent. That the patient then is committed to the sick role. There's tons of paperwork involved, and sometimes that paperwork really feels intrusive, especially if you are living with others and it's for one of the needs-based programs. You're really needing to put kind of your whole financial life out there. So again, some of the things that I came up with are along the lines of what you guys are talking about, that stress of the application process. It's a very long process. that self-image of being disabled and others' image of you being disabled. And so I would encourage all of us to think about when you're meeting someone for the first time and you know they're on Social Security, what might be your thought even about what that means about the individual. And for some individuals, it may even be demotivating to then try and work because, well, if I had this other thing going on, I might be afraid that I would lose it and it might demotivate me from actually trying to work. So now let's flip the script. Let's think about what are the advantages of not applying for disability. And again, put in the chat or speak up.
Well, there's a real incentive then if you don't have an income to try to develop or to use whatever skills you have, or to work much, much harder at getting employment and keeping it.
Absolutely. Yeah, how many of us at the point that we needed money, our first thought was go apply for Social Security, as opposed to we need money. What do we do to get money? We get a job, we, tap our resources for, some support, maybe some financial loans, things like that. Seeing time savings, privacy, not having to delve into all the details. Very good. Yeah. Some of the things that I was thinking of, some of it's pride and self-esteem. I'm going to try this and see, what I can do. They want to be a contributing member. I've heard people say, I don't want to be a drain on society. Maybe support not seeing themselves as disabled and exactly like Bob was saying, being motivated to work. Oops, didn't mean to do that. Got a little heads up there. So now our last box in our decisional balance, what might be the disadvantages of not applying?
The first disadvantage, if you don't get it, the access to medical care is really very, very difficult. And so the nature of having any kind of an insurance policy really allows entree into the healthcare system dramatically.
Absolutely. Yeah, in the chat, I'm seeing limited resources. You paid in. If you don't apply, you lose it. That's an interesting perspective. Any other disadvantages of not applying? So again, I'll share kind of that stress on finances, especially if you're relying on others for that support. And people do experience guilt if they feel they're not contributing financially. So that there's no clear-cut answer. And that's the importance of really looking at these pros and cons and looking at, what's going on. And sometimes people may not share these things. I would encourage you to do this process with anyone with whom you're working when they're thinking about whether or not they want to apply. And so when I was pulling this together, I also talked with a bunch of colleagues and people that I've worked with in various ways. And so these are some interesting perspectives as well. So one individual actually said, SSI really helped. I was traumatized by being fired from my job. All my coworkers seeing me paranoid. I couldn't face working again right away. A parent basically said, are you saying my daughter has schizophrenia just because has schizophrenia that she's disabled? And that's, I think, a really important piece that we don't want to equate just because someone's experiencing psychiatric conditions means that they're not able to do other things. We really need to look at that functional capacity, not just a diagnosis or set of symptoms. Going back to our previous exercise, I had so who wants to live on $842 a month? And really looking at, are we kind of leaving people in poverty and comfortable and leaving people that far into poverty? Someone else said, Social Security is not a bad thing. It's a choice and needs to be an informed choice based on figures, but it does have implications down the road. It's a myth that SSI equates to financial security. again, that $841 a month, would you feel financially secure on that? Which feeds into how do we help people see this as a temporary support, not a lifestyle. So again, depending on where someone is and what their needs are, what their abilities are, this may be a really good temporary support to help them carry through and give them access to some other resources and some other processes and times. Someone else said, we need to examine our willingness to allow people to take risks. We are so risk averse. We want to protect them. So we focus on applying for benefits and don't encourage work because that might be perceived as more risky. I thought that was kind of interesting. And are we helping people with recovery, or are we okay maintaining them in poverty? These are all some just interesting things that I wanted to share with y'all and see what that kind of means to you and where you might go. So when I think about our role when we're working with patients, absolutely we want to help individuals explore those pros and cons. Regardless of the decision to apply or not, that conversation going through the pros and cons are going to give us all the information that we need to then work with that individual. So if someone has anxiety about going back to work, let's focus on that anxiety. How can we help them build skills to deal with that anxiety to then be able to follow their goals? If they're saying that they don't feel confident they can do it, we can work on building confidence. If their goals are for independence, we can help them see what can help them build that independence. If it's that self-perception or others seeing them as disabled, how else does that affect how they interact with others? And is that some targets that we can work on? And I have referenced a few times, there's a wide range of resources and incentives that help people get back to work. And so whether it's instead of applying for Social Security or for individuals who are already on Social Security, there's a wide range. And we had our individual talking about that they're doing employment work, vocational work in a community setting. We also want to make sure when we're working with individuals that the employment goals are not focusing on that what won't impact their benefits. And that goes back to the conversation we had earlier and that 3% statistic that talks about how few people actually get off of benefits entirely. So instead of focusing on what won't impact their benefits, let's focus on what are their employment goals and how can we help them navigate all the systems and structures that are in place and what incentives do exist. So I do have a list of some basic resources. Social Security actually has some really cool stuff on their website. I quoted the Red Book a lot, which really talks about what the different programs are and the work incentives. And I think those are the key pieces for us to really understand. There's a lot of incentives that help people maintain some level of external support while they're really building that work history and work goals. And also there's a program called Ticket to Work that can really help individuals kind of move on. And so I kind of open it up to us for thoughts. And I'm going to stop sharing.